Your healthcare provider has ordered a medication that will be administered using an elastomeric device. This instructional video will help you administer your medication effectively, comfortably, and safely. To get started, remove your medication from the refrigerator at the time specified on your medication label. Never speed the warming process by heating or microwaving the medication. Select a clean work area. Once established, clean your hands thoroughly using antibacterial soap and warm water. If no soap and water is available, use an alcohol-based hand sanitizer. Follow by drying your hands with a clean towel. Gather your supplies and prepare your sash mat as instructed. Medication ball, flush syringes, alcohol wipes, and if necessary, sharps container and/or trash container. Inspect the medication ball. Check the label and verify. Correct name of patient and medication. Volume, amount of medication. Discard date of medication. Amount of time needed to remove medication from refrigerator to warm to room temperature. Prior to using syringes, push firmly on the thumb press with the tip cap still on, just until you feel the plunger move. Expel air and excess solution by twisting off the tip cap and pushing the plunger forward. Push out extra solution to the amount instructed by your nurse. Finally, replace the syringe cap, being careful not to touch the tip of the syringe with your hand. If you touch it, you will need to start over with a clean syringe. Set aside the syringes until you are ready to use it. Repeat this step for all flush syringes needed for dose. You are now ready to flush your IV line with saline. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove the protective cap from the saline flush syringe. Attach the saline flush syringe to the needleless connector using a push and clockwise twisting motion until secured together. Open the clamp on your IV catheter and/or IV extension set if indicated. Flush your IV catheter using a push-pause method. Do not attempt to flush if resistance is met. Double check that all clamps are open, then call your nurse or pharmacist. Lastly, remove and discard the saline flush syringe in a trash container. You are now prepared to administer your medication. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove the protective cap from the medication tubing. Attach the medication tubing firmly to the needleless connector on your IV catheter. Open the clamp on the medication tubing. The medication will run over the specified number of minutes as instructed by your nurse. If the medication ball does not deflate as expected, double check to make sure all clamps are open. If the clamps are open and the ball is not deflating, call your nurse or pharmacist for assistance. When the medication ball is completely empty and deflated, close the clamp on your medication tubing. Remove the medication ball and discard as instructed. You are now ready to flush your IV line with saline again. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove the protective cap from the saline flush syringe. Attach the saline flush syringe to the needleless connector on your IV catheter. Flush your IV catheter using a push-pause method. Close the clamp on your IV catheter and/or extension set unless you have been instructed to flush with heparin. Lastly, remove and discard the saline flush syringe in a trash container. This will conclude your IV medication administration unless heparin has been ordered. If ordered, you will need to flush your IV line with heparin. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove the protective cap from the heparin flush syringe. Attach the heparin flush syringe to the needleless connector on your IV catheter. Flush your IV catheter using a push-pause method. Close the clamp on your IV catheter and/or extension set if indicated. Lastly, remove and discard the heparin flush syringe in a trash container, thus concluding your IV medication administration. Here is a SASH procedure summary to ensure you are administering your IV medication effectively. Flush your IV with saline. Administer your medication over the number of specified minutes. Flush again with saline. Flush with heparin. With each administration of IV medication, you will get more comfortable with the supplies and the steps. For any questions or concerns you might have, please contact our highly trained specialty nurses or pharmacists who will help you understand the basics of home infusion therapy and will answer any questions.